Welcome to the interview. Today I'm going to be the candidate, this is going to be the interviewer, and he's going to be probing me on specifically topics surrounding acid-base balance. And he might lead me towards a very specific direction in order to kind of simulate what it will be like on the day with tougher and tougher questions. So take it away.
What is your understanding of a buffer system?
A buffer is basically a substance that can kind of reduce the change in pH for certain differences in conditions.
And how is a buffer system set up? What does it revolve around? What are some of the key concepts you need to have in order to have the system that can counteract these changes?
A buffer system set up basically is a reversible reaction where you have a weak acid which will go into an acid, H+ ions in particular, and a conjugate base, as they say. This will be the pair formed.
And what about for an alkaline situation?
Alkaline situation, it would be a weak base, and it would be a reversible reaction again to form OH- ions and a conjugate acid.
Okay, so what is your understanding of maybe a buffer system that is present in the body? More notably in the blood.
Well, in the blood, I know in order to remove H+, we use a substance called bicarbonate.
And what is the reaction that is going on here?
So H+ will react with bicarbonate to form carbon dioxide and water, which are two neutral products.
And kind of where do you think this buffer system is controlled? Or where in the body would you be having these reactions taking place to control the acidity or alkalinity of blood?
Well, in certain organs, like maybe the lungs.
Why would you say that? What about this equation or this reaction would you think can be, how do you think it can be controlled in the lungs?
Well, the product of CO₂ is characteristic of the lungs. It's involved in ventilation. So that's why I've been inclined towards that.
So you mentioned ventilation. Do you think you can control the amount of acid through ventilation? What would the steps be?
The first step would be for the buffer bicarbonate to react with the acid to form the CO₂ and H₂O. And after that, as you said, through ventilation, you want to release CO₂. And the reason, in the terms of chemistry, which is I think where you're headed, is because as you reduce the concentration of CO₂ by exhaling it, it will shift the reactants more towards that to continually remove acid in the lungs.
Okay, yes, that's correct. So how would changing the ventilation rate be able to allow you to control this?
So increasing ventilation would remove more CO₂, which would shift the position of the equilibrium more towards the products and remove more acid. So that would increase the pH. And if there's less ventilation, then less carbon dioxide is being removed. So it would shift in the opposite direction, which would produce more acid and could lower the pH.
Yes, that's correct. So let's take, for example, how do you think you could help someone that's, let's say, hyperventilating? What's a common thing that they do to so if you're releasing a lot of CO₂ because you're breathing quite rapidly, then you have alkalosis.
Right.
So how do you think you can control that? What do you think you need to do? This is really simple, very trivial thing that you'll see in movies or...
Yeah, okay, I think what I know it is. So alkalosis is increasing so more alkaline. So what you kind of want to do is to make sure they breathe in more CO₂, in a sense. So what I've seen in movies is they might put a paper bag over someone's head, and that means they'll breathe in more CO₂ and shift more towards the acid part of the reaction, which would then lower the pH.
Okay. And why do you think it's important to kind of increase the or decrease the blood pH in this case. How do you think blood pH affects oxygen loading? If we're looking just at the lungs here. What do you know about some of the properties of hemoglobin and oxygen binding that means pH is liable to affect this?
So I know that if you if you have more H plus ions, they will bind to hemoglobin and change its structure. And changing its structure in the context of hemoglobin, I know also means there'll be less affinity. So it's usually used to remove oxygen. So back to your question about how would changing the pH affect that, I think if you reduce the pH, it would reduce the affinity for oxygen, and if you increase the pH, it would increase the affinity for oxygen as H plus would move away.
So how would that affect oxygen loading or unloading?
It would.
How does the affinity of hemoglobin affect the loading or unloading?
Increasing the affinity for oxygen would increase the loading of oxygen onto hemoglobin, and decreasing would mean more is offloaded. So that could be more useful for tissues, for example.
Yeah. So I was just going to ask you just a point, just a quick touch upon why is it important in metabolically active tissues that you have increased unloading, and how can you regulate that with hydrogen and acidity?
Right. You want to offload more oxygen because it's going to be used in respiration. You don't want the oxygen to remain bound to the hemoglobin. So in that example, you would want more H plus in order to bind to the hemoglobin.
And what would cause this increase of H plus if you had metabolically active tissues?
It would maybe because of respiring tissues would produce lactic acid. In anaerobic respiration, and that would produce H plus ions.
Have you heard of the double Bohr effect by any chance?
No.
So what other factors do you think affect unloading into tissues? We've talked about acidity. What else separates metabolically active respiring tissue from a tissue that is not at a high metabolic rate? What are two things that, let's think of this as an input-output system. What is a respiring tissue using, and what is it giving out?
Respiring tissue is going to be using oxygen and giving out CO2.
So how do you think the concentrations of oxygen and CO2 will be different in a high metabolic tissue?
I think there'll be more CO2 because that's what's going to be producing less oxygen.
Yes, so this is what the double Bohr effect is referring to here, where you have low concentrations of partial pressures of oxygen, high partial pressures of carbon dioxide, and these both act synergistically to release oxygen from the hemoglobin. Okay. Now let's look maybe at the other side of the system. We've looked at the lungs. Which other organ system is involved in regulating blood pH?
The kidneys.
And how? So let's say what's the equation or the reactions kind of taking place here?
Would it be?
So we've had your carbon dioxide in your water formed from your carbonate.
Yeah.
What's the other side of the picture?
So there needs to be a way to remove nucleic acids when they break down. So I think should be to do with H plus and H₂CO₃ minus forming phosphoric acid.
Not really. We're just talking about the buffer system. But you're along the right lines. You have your H plus acid, and then you'd have your HCO₂ minus ion. Yeah, but it's the ions that we're looking at here. And so what happens in the kidney? Do you know kind of what the process would be of how you are excreting your hydrogen?
You would want to shift position again to remove acid by putting it into another product, kind of similar to the ventilation, and then remove that product through the urine.
Yes, okay, so what do you know about, let's say, the properties, let's say, what do you know about cellular transport between cells through tissues? Let's say the kidney, you're at the lumen. what are you doing to get rid of hydrogen? Are you excreting? Okay, so do you know any conditions or disorders that affect hemoglobin? It's perfectly fine to not. But if you know anything, that would be.
No.
So how do you think hemoglobin could be affected as a molecule? What is it, first of all? Do you know anything about its structure?
Yeah, it has a central heme ring with iron in the middle, and iron in the middle and 4 heme rings surrounding.
Yes, and do you know how the iron is attaching? What it's attaching to? What residue? It's perfectly fine to not know. It's okay, we can move on. So where do you think there could be a problem if, let's say, someone had some sort of anemia and they had reduced red blood cell oxygen carrying capacity? Where in the structure, or kind of which bit do you think could be affected?
On the hemoglobin?
Yeah.
Well,
you have no idea.
Maybe if less oxygen is binding, it might not be having a good affinity to oxygen in general.
And where do you think there could be a problem in the hemoglobin molecule? Do you think it could be maybe having shortage of iron? Do you think it could maybe be having misfolding of the heme chains? What would your idea be?
I think a shortage of iron, because iron is what is going to attract the oxygen. It's like the central iron.
Why do you think if you had a shortage of iron that would cause anemia?
Well, I think less hemoglobin could be formed as a result, so less oxygen could bind to it.
And how do you think having less iron would affect the size or the shape of the red blood cell?
Oh, I think it could, so it has a nice biconcave shape, the red blood cell. I think it could curve it or form it into what's known as a sickle cell.
Not quite. You see, the shape is not really affected by the iron, it's mainly the size. If you don't have much iron, then you have something called microcytic anemia. Smaller red blood cell size, then you have less red blood cells being formed, as seen basically. What about the colour of the red blood cell? How would it look?
It would look darker.
Do you think so? What does iron give to the red blood cell? What is the colour of hemoglobin?
Red.
And if you're forming less
hemoglobin,
that would make it
less red.
Yeah, it would make it paler.
Oh.
If you were to go into the fine details of it all.
Okay.
What about with the hemoglobin? Do you think, or the heme group? Do you think those could have problems as well?
Yeah, they might not attach onto because they can't attach onto the iron if there's not enough iron to form the hemoglobin molecule.
Because isn't it, which part of the hemoglobin molecule binds oxygen?
The heme ring.
Yeah, so what do you think could be wrong with the heme ring?
Might have a different tertiary structure.
Yeah, so have you heard of anything along the lines of alpha or beta thalassemia?
No.
Well, these are genetic disorders where you have misfolding of these heme rings, so you have reduced affinity to oxygen. And how do you think, let's say, someone that has reduced oxygen binding capacity in thalassemia, what would be some of their clinical presentation? What are some of the symptoms they may have?
They might have shortness of breath.
Yeah.
Fatigue, because the muscles are not getting enough oxygen as well.
What about the color of their skin? Yeah, muscle weakness, good.
It might be paler.
Yeah, have you heard of something called cyanosis?
Cyanosis, vaguely.
It's kind of very kind of like bluish skin from lack of oxygen.
Okay, interesting. Why would it be bluish?
Because if you're losing blood to the area, you will start dying basically. So it's on the way to necrosis if your tissue is cyanotic.
Okay.
Okay, well, Thank you very much for coming in today. This was our mock Cambridge interview. I hope we're able to draw on a lot of the it's not really what is discussed, it's how it's discussed, and just be able to show you how the interviewer kind of probes and how you and what they're looking for or what they expect. They're obviously there to help you give clues and guide you to find the answer. Yeah, so, and even from the perspective of the person getting interviewed, you can see how to maybe go about answering some of these questions, what to think about. Because there's no wrong answers or anything. I mean, there are wrong answers, but it's about how you approach the question or what you're thinking and just trying to show that to the interviewer. Thinking out loud is really important.
Yeah, okay. Even as a candidate, that was a very valuable experience for me. Hopefully we will continue this, gain more insights so you can see how kind of the interview process goes and what they're really looking for. Some of those answers I didn't even get right myself, but giving it a go is very important. So stay tuned. We'll see you in the next one.